Hi guys, this is Amrit and I'd like to welcome you to OSProEd. Today we're going to be discussing operation notes, and before we do that, please keep in mind that this video is for educational purposes only, and please never practice medical skills without the proper credentials. Let's assume that you got a job as a HMO in a busy metropolitan hospital in Australia. You have been paged by the nurse to review a patient who is a 58-year-old gentleman by the name of James. And Mr. James had just arrived on the ward bed post a laparoscopic cholecystectomy. The nurse have now called you as the patient is in a pre-met criteria with hypotension and tachycardia. What do you do? Okay, so the time is ticking. What are you going to do? Obviously, you will follow your DRABC protocol and then do the needful. But the operation note, also called as the op note, is a vital document that records exactly what operation a patient had, what was found during the surgery, if there were any complications, any major blood loss, and most importantly, the plan from the surgeons. Some hospitals have a paper-based system, whereas the others have an electronic system. The operation note can be found on either one. Keep in mind, guys, that an operation note is a medical legal record of a patient's care during hospitalization. When you do a surgical rotation, a majority of the work for junior doctors is to follow the operation notes plan. All operations note must be completed immediately after an operation by a member of the operating team. These notes are found in the patient's file and accompany the patient to recovery and then to the ward. Also, after discharge, when we review patients in the outpatient clinic post-operatively, say like 2 weeks post-op review, we again look back at the operation note to understand what had happened. Apart from doing the surgery, the surgeon's job is to also make sure that the operation note, including the post-operative instructions, are written clearly and concisely. A good operation note will have the date and the time of the surgery, whether it was an elective or emergency procedure, the names of the operating surgeon, the surgical assistant, and the anesthetist, the names of the operative procedure with the incision that was made, the operative diagnosis, and the findings. It will also have the complications and any additional procedures that were performed and why they were performed. It would also include any tissue that was removed or altered and any prosthesis that was used, including relevant serial numbers of the product. There would also be details of closure techniques with the estimated blood loss. Antibiotics and DVT prophylaxis would also be there, and a detailed post-operative care instructions need to be listed. For you as a junior doctor, the post-operative instructions is where the money is. Make sure that you follow this section. Ideally, this should be accurately recorded to document any specific plans to be carried out after the procedure to ensure there's a good post-operative care. This includes any medications that need to be given. So for example, VTE prophylaxis specific to the surgery, if a patient may eat or drink, if the patient is able to be discharged home, if bloods are to be repeated, and any follow-up action required, including dressing changes or suture removals. If you're unsure of the plan in the op note, do not hesitate to pick up the phone and ask your seniors on what the intended plan is. Always clarify when in doubt. In the case I mentioned above, Mr. James, looking at the op note, he had an intraoperative blood loss of 1,500 ml due to complicated vascular injury. That alone can explain the tachycardia and the hypotension, which the nurse was worried about. Whenever you have post-op cases, do not forget the operation note. And when you ask the examiner for the physical examination findings from the examiner, ask specifically about the operation note findings, if there were any complications or any specific plans requested by the surgeon. I hope this was useful information for you. I wish you all the very best in your exam preparation. Please don't forget to hit the like and the subscribe icon. And until next time, take care of yourself. Thank you.